and down the country. We followed Wendy and her volunteers at one clinic in London.
Across the UK, over 80,000 people have given up their free time to help vaccinate our population. These COVID marshals and stewards are the oil that keeps the engine running, helping people in and out of vaccination centres.
Good morning, everybody. Welcome.
Dr. Wendy Furman manages the volunteers at this London GP practice.
This is all second vaccines. We're more likely to have people with carers, more likely to have some very frail, elderly, making sure we keep socially distancing, keeping everybody safe.
Some key information this morning.
We've got the Pfizer vaccine, so it's 15 minutes of observation after having the vaccine. OK, all right, I think we need to get on then. All right, good luck, everybody.
Right. Everything is organised to make sure no vaccine is wasted.
We know that this week we've had a delivery of Pfizer, and we know that's giving us 900 doses, and that has to be used really within 4 days by the time we get it, and then it would have to be discarded.
Can I just ask if you've had any of the following symptoms?
Lisa Maguire has taken a break from her day job as a journalist to volunteer at the centre.
So it runs quite efficiently because there's marshals stationed at every stage, so we can kind of filter them through as soon as there's a seat in the waiting room. So they've really got it down to a fine art now.
Her employer gives her 2 days off a year to volunteer.
So we really rely on each other as marshals, so somebody can pick up my slack if I'm working with one patient who's anxious and needs a bit more conversation. So we have to really work as a team in that situation. There's been so many times where people turn up at these gates and they'll be like shouting over the fence, like, have you got any spares? But yeah, it doesn't really work like that. Everyone's got an appointment. And do you need a companion with you today?
At the moment, we're doing 400 a day. Sometimes we do a bit more than that. So today is about 1 every 90 seconds. So our marshals are quite key to enabling the smooth passage of patients through the practice.
This is probably my 15th shift since I started in January.
Jonathan Haslam was a headhunter before retiring last December.
We can accommodate people who come early within reason. We had one gentleman this morning. He had made a note of the date, and because of the Pfizer vaccine, it has to be kept under strict conditions. They only take out enough doses to match the programme, so we couldn't give him his vaccine at 9 o'clock this morning when he's actually due at 5 o'clock. So sadly, we had to send him away.
Thank you.
After meeting Jonathan at the door, patients are then directed by stewards like book editor Diane Pengelly.
My colleague Andrea there needs to know how many we've got, so I'll give her a 2 or a 1 and... Good morning, hello.
While it might seem like a simple job, it can mean a lot to the patients.
Can I sit down?
Please.
Thank you very much.
Thank you. I don't think it'll be a long wait.
Very kind of you.
It's my great pleasure.
It's nice for you people to be here.
Well, it's very... Well, it's
a nasty time.
Student Becca Furman is the youngest volunteer at the practice.
So it's really interesting to talk to older people, especially because there hasn't been much contact with any of them in the past year at all. Yeah, I think it's, you know, in the whole of coronavirus, it's been really hard on young people, and I will do everything I can to try and minimise the effects of it.
Please sit down and tell me about yourself.
Retired surgeon Andrew Montgomery is one of the oldest volunteers at the surgery.
The joy of coming to give people vaccines is you're actually giving them good news, and it makes them happy. Have you got your card so I can just check that I'm giving the same thing?
As a doctor, Andrew is actually administering the jabs.
You're offering me the left, are you?
Pfizer vaccines must be stored at extremely low temperatures.
You've got to use it within 2 hours of taking it out of the fridge. They have a little plunger that goes into where the needle goes to make sure that there's minimal wastage of the fluid that goes in, because it's a very, very small volume, 0.3 of a mil. Would you like to press on that for a minute?
Yeah.
It's just...
Hello, ladies. We have some seats, so if you wouldn't mind waiting for 15 minutes.
It isn't required with the AstraZeneca vaccine, but after the Pfizer jab, patients are asked to wait 15 minutes. And here, it's under the watchful eye of criminal QC, Miranda Haslam.
For the last 3 months, I've been involved in a long trial, and so today I've got day off, so I'm back here as a volunteer. We're watching for anybody that feels faint. I think most of it's anxiety rather than reaction. It's quite stressful for some people who've been shielding. and this is probably only the second time they've been out.
Today, the COVID Marshals' efforts do not go unnoticed.
Do you need a companion with you today? No. No? Great. We go. Oh,
They're not all for you.
Oh,
Can
wow.
you do sharing?
Oh, wow, is this for the... Oh, this is the first time I've ever got a gift.
Oh,
Exciting, yeah.
Oh, that's
yeah,
great.
everyone will really enjoy that. Thanks so much.
Oh, I just think it's lovely of you to be doing it.
My friend said to me recently, actually, to boost your self-esteem, you should do esteemable things. And I think that's such a nice phrase. Like, it makes you feel good, and also you're helping other people.
With over 43 million vaccinations given in the UK so far, this national effort will continue to rely on the generosity of volunteers, given their time
Thank you, bye-bye.
and ready to start the whole process again tomorrow.
We've had such brilliant feedback from everybody who comes through, from all our patients saying they've been so well looked after, friendly face, it's just been efficiently run, and I really think that's is a credit to our volunteers.
You're making a break for it. Okay, well, bye-bye.
It's brilliant.
It really
people